off and your mic's on mute if you're not speaking. That helps with the bandwidth. And then we will have time at the end to take media questions. So if we can hold those until then, that would be great. All right, Mayor Engen.
Oh, thank you, and good afternoon. I appreciate everyone taking the time this afternoon. I'm John Engen, Mayor of the City of Missoula, and today we wanted to announce that in collaboration with our many partners in local government, healthcare, and the private sector, I and the Missoula County Board of Commissioners have appointed Adrian Beck, who is on this conference with us today, the Director of Missoula County Emergency Operations, as our vaccine deployment officer for the city and the county. Our incident command team, some of whom are represented here today on this call, continues to managing the taxing and relentless work of testing, contact tracing, quarantine and isolation, and as a practical matter, that team needs some help during this critical phase of the pandemic response. Ms. Beck and her team, along with support from the Missoula Fire Department and our cooperating agencies, will coordinate Missoula's vaccination deployment, making it crystal clear who is eligible and when they are eligible for the vaccine based on the governor's implementation schedule. Today, there's plenty of confusion, and we're aware of that around who gets vaccinated and when, and Adrian and the team will be working to temper that confusion. We believe we can get as many doses of vaccine as we can administer, so we are coordinating mass clinics to ensure that we can administer those thousands of doses. The approach here will be decentralized but highly organized, and that's the thing to keep in mind. This effort is really what Ms. Beck and our team are built for, because this is about communication, coordination, and logistics, which are the EOC's stock in trade. I have the utmost confidence in the team and our ability to be an example for other jurisdictions for vaccine administration. Vaccination puts to rest this variant of the global pandemic in Missoula, saves lives and suffering, and allows us to return to whatever normal means in the wake of this long struggle. I'm grateful to Adrian and Missoula Fire Chief Jeff Brandt for their collective teams for stepping up to take on this critical mission. And I'm also extraordinarily grateful to Ellen Leahy, Cindy Farr, and their team at the Missoula City County Health Department for getting us this far and continuing that challenging work of keeping track of cases and making sure that we're doing everything we can to temper spread. Those teams will coordinate closely to ensure that our community is immunized safely and effectively. With that, I'm happy to turn the proceedings over to my colleague, Commissioner Josh Slotnick from Missoula County.
There we go. Thank you, Mr. Mayor, and thank you all for being here today. I'm really excited to be part of this and to be part of this effort and part of this announcement too. So as the mayor pointed out, our current vaccination situation is deeply decentralized. We have the university, our two major hospitals, the health department, PHC, all nations, and even our long-term care centers and commercial pharmacies involved. It's a very decentralized system. It's calling out for coordination. This is also a fluid and rapidly unfolding system. So as the mayor said, we are handing over coordination and logistics to a person who should just be called coordination and logistics. Let's stop calling her Adrian Beck. Adrian and her staff, as the mayor pointed out, are built to do this. This makes complete sense. And I'm really excited to say on the phone call yesterday where we were talking about this, we didn't just have kind of acquiescence from all the partners, but enthusiasm. People are asking to be coordinated, and everyone was united in that effort, in that desire, and also in their confidence that Adrian and her shop were the folks to do this. So I wanted to introduce Adrian. I also wanted to make sure and thank, as the mayor did, the folks who got us to this point in vaccination distribution. Ellen and her team have done a great job and done a fantastic job on testing, and expect more good in the future. Also wanted to point out that this isn't just a metropolitan Missoula effort, that folks in our outlying communities who make up a large portion of that number of well over 30,000 souls that are in Tier B will all benefit from this. So with that, I'd love to introduce our colleague, Adrian.
Thank you, Commissioner. And coordinator is actually in my title as one of the many that we have that Disaster and Emergency Services Coordinator. So I'm Adrian Beck, and I'm the Director for the Missoula Office of Emergency Management. And as you've just heard, we've been tasked with vaccination coordination for all of Missoula County. The stakes and expectations around COVID-19 vaccination could not be higher. We as a society have lived a life disrupted for the last 10 months. However, this disruption has not been evenly felt. For some, it's been just a disruption or an inconvenience, but for others, it has resulted in an irretrievable loss. For most, this vaccine is a gateway for normalcy. For many others, it's a life-saving measure that we cannot understate. The pace with which this vaccine has been developed is nothing short of remarkable. So too must be our execution in getting our community vaccinated through strategic prioritization of individuals who are most at risk, coordination among vaccine providers, and information dissemination to the public. This unprecedented vaccine rollout will not be without complications, challenges, and unexpected variables. But I'm confident that we as a community have the resources and relationships to get it done in an expedited and efficient manner as those resources.
This is Peter. How can I help you?
Someone muted there? Okay. And we're asking for our citizens to be active participants in this process, to pay attention to the prioritization criteria, to be informed about where you personally fall in that categorization, and to be ready to receive the vaccine when it is time. Much like boarding an airplane, the process goes much quicker when those waiting to board are ready to get in line when their section is called, and that those who are not yet in the queue continue to wait. Getting wide participation in vaccination among our citizens is one of the most important things that we can do amid this global disaster. The Office of Emergency Management, through the Emergency Operations Center, is deploying the Western Montana All-Hazard Incident Management Team to coordinate vaccination across Missoula County. This team is comprised of individuals who specialize in incident management. Incident management teams are utilized in all types of emergencies to bring strategic organization and objectives-based management to complex scenarios and situations. This team has been deployed numerous times to address complex disasters locally and across the country. We are truly fortunate to have this expertise in Missoula County. The realities of how this vaccine will be delivered and to the scale to which it must be delivered do not lend itself to single centralized access point and distribution, but rather we must have as many access points across the community as possible, and that this reality is what necessitates this centralized coordination effort. This Missoula County Vaccination Coordination Team will aim to open lines of coordination among all vaccine providers to ensure accurate and timely information and data exchange, coordinated vaccine efforts, sharing of resources where appropriate, and planning for each phase of vaccination in Missoula County. This team will remain in place until COVID-19 vaccine is widely available in Missoula County to any resident over the age of 16 wanting to get vaccinated. In the coming days and weeks, we will begin to collect and provide information and data to reflect not only what has been accomplished to date, but to the greatest extent possible what to expect in the immediate future as we look to enter Phase 1B. This team will establish methods to share and report information among vaccine providers, as well as with the public. As we enter Phase 1B and phases beyond, this team will develop strategies for identifying and connecting eligible citizens with a vaccine provider for administration, as well as coordinating efforts around mass vaccination events across Missoula County. Missoula County and cooperator vaccine providers are anticipating completion of Phase 1A in the very near future. Phase 1B will present a much larger contingent of the population that necessitates the implementation of this coordinated effort and more vaccine access points across the county. We ask for the public's patience as we develop the strategies necessary to ensure that Missoula County residents who meet the Phase 1B criteria can be connected to a vaccine provider in the quickest, most efficient manner possible. Please continue to monitor trusted sources of information to ensure that when it's your time to get vaccinated, that you are ready. Thank you very much, and we look forward to getting to work.
All right, thank you so much, Adrian. So now we can open it up to media questions, and if you guys want to use the raise hand function, we'll do that with people who are online first, and then we'll call on the phone numbers. All right, Ross Miller.
Yeah, thank you. This is Ross Miller. I'm here representing the Missoula City County Board of Health, and just want to, on behalf of the Board of Health, just want to state that the Board of Health just very enthusiastically supports this plan. We think it's a great utilization of city and county resources. Got a lot of confidence in Adrian and her group. We've worked with her a lot in the past, and just think this is a great thing for our community to take advantage of the resources that we've had and just to optimize the resources we have within our community. I think we've all seen over the past handling of this pandemic nationwide that leadership and management from the very top really matters, and it really actually saves lives. So our community, this is just another demonstration that our community is doing what we can to provide that leadership and management, and just very supportive of it. And just thank you very much, Aiden, for stepping up.
Thanks, Ross. Do we have any media questions from anyone on the line? Cameron?
Hi, I just wanted to clarify, I may have missed this, but if we know how soon we're moving into phase 1B, yeah, that's it.
Thank you, Cameron. You know, we are in constant communication not only with the Missoula City County Health Department and their incident management team, as well as the vaccine providers, and some of them are on this call who may wish to weigh in. We're currently working through the 1A population as has been identified, and we anticipate that we're getting very close to the end, but we still have some time to go, potentially as early as a week.
Great, thank you so much.
Okay, any other questions from anybody who's online? All right, looks like we just, oh, go ahead.
Hey, this is Megan with KPAC. Sorry about that. I have kind of a specific question. Are you, or do you guys have numbers about quantity of available doses of the vaccine moving into phase 1B? For whoever wants to grab that, maybe Adrian?
Sure. So I think you're hitting on one of the reasons why this coordinated effort is so critical, in that because it is decentralized, because there are many opportunities for vaccine providers to become registered vaccine providers with the state of Montana, and therefore then they can order their own vaccine. Getting those numbers and knowing what is available in our community is probably our number one priority that we need to get a handle on. As far as what's happening at the federal level and how vaccine is being rolled out to states, that continues as it is. We know that we don't have enough today, and we know that we aren't expecting a huge shipment that's going to take care of all of 1B. So we'll have to be strategic and prioritize as we go through that.
Okay, perfect. Thank you.
Henry?
Hi, yeah, Henry from the Pathfinder in Sealy Lake. I just was wondering if I could get some insight into how Partnership Health Center would fit into the vaccine distribution plan.
Is Partnership Health Center represented with us today? Thank you.
Yeah, I was just going to ask if Lori Francis or anyone from Partnership Health Center is on the call. I would more than welcome them to answer that. But they are a vaccine provider, and we do intend to coordinate with them for rollout of the vaccine as well.
This is Eric Halverson at Partnership Health Center. I don't have any comments to add beyond what Adrian said. I would just echo exactly what she just said.
Okay, thank you.
Thanks, Eric. Let's see. Cameron, did you have another question?
I do. I was also curious if this team has had any conversations yet about kind of making a way for people in phase 1B to like go online and sign up, or how they're supposed to get in line, so to speak?
That's an excellent question, Cameron, and certainly one of our primary objectives is to make sure that anyone who meets the current criteria for vaccination as we get into those phases has an accessible way to know where to get vaccinated and can intuitively figure out how to get to registered with whatever provider is available.
Martin? Are you able to unmute yourself, Martin?
I just did. I apologize. Thank you. Good afternoon. Adrian, I'm curious your thoughts on Governor Gianforte's announcement yesterday regarding the rollback of the Bullock administration's COVID precautions, and if that will only expedite perhaps the urgency for a solid vaccination distribution plan here in Missoula.
Well, I would certainly defer to Ellen Leahy or Ross Miller from the health officer or the chair of the Board of Health to weigh in on that. But you know, as I stated, I think that getting our community vaccinated is one of the most important things that we can do amid this pandemic, and we're going to be full steam ahead to get it done.
Thank you.
Ellen, did you want to weigh in on that at all?
I would just say that it's long been our planning assumption that we will see another spike in cases. And I think the mayor opened this in a general way by saying we will continue to be busy, and perhaps we expect busier with those cases. And we are adding vaccination to our plate as well, but as a partner with all the others. So yes, it will be difficult, and it will increase the demand, I believe, for quick vaccination. And that's why I am so grateful to see not only our community partners who have already stepped forward with the healthcare worker rollout, which is a large one in this county, because it does require vaccinating a lot of people who work here but don't actually live here. So I appreciate that. And when they saw the switch up to put the most vulnerable first, which we embrace, even if we weren't looking at an increase in cases, they stepped forward and said, we want to help. And I think today's mechanism brings that coordination and the way for them to help forward as we continue to deal with the pandemic itself.
Thank you, Ellen.
All right, real quick, I want to get to the phone numbers. 4381, the number ending in 4381. Do you have any questions? You can unmute yourself. *6, I believe, is how you unmute from the phone. Sorry. Okay. 5021. Okay. Let's see. Cameron, did you have your hand up again? Sorry, it's hard to tell with Teams.
I do. I'm sorry.
You're fine. Ask away.
These questions. Only other one I think is with all these partners, I was just kind of curious about vaccine storage and how plans are being made for that, in terms of like if every facility or partner is going to have that cold space. Yeah.
I can generally speak to that. Not every partner will have that ultra cold storage, nor will every partner need to have that. We currently have that in the community in 4 locations for that particular brand of vaccine. And now we have a second brand of vaccine that doesn't require that. I think that we will be able to get to a point where we will be able to distribute, which is part of the federal and state plan, out of those large cold storage for the Pfizer vaccine to other vaccine administrators. We are not quite at, the state are not quite at that point yet, but I don't think that every administrator needs that type of storage.
Okay, great. Thanks, Ellen.
Any other questions from the media? All right, well, thank you so much for joining us, everyone. We will send out a recording of this as soon as we can get it uploaded to our YouTube channel. Thank you.
Thanks, everybody.
Thanks, everyone.